I'm going to talk about autism in older people. Well, yes, this is a subject that not many people take into account because when we talk about autism, it's mainly about children, but it does affect older people as well. So we have this traditional autism and Asperger's syndrome, which is now not used as a name. But we are talking here about high intelligence. For me, autism is hidden genius. In other words, the person who is diagnosed as an autistic basically is a genius person, which doesn't allow him, the society doesn't allow him to express the feelings. So people who were young without autism may grow and become older people without being properly diagnosed because the diagnosis at the time wasn't very clear, not very recognized. So we have an increasing number of older people who had autism as children, and now they are presenting the symptoms as adults. These people are more likely to have other illnesses and may be diagnosed with conditions that are found in aging, like depression or anxiety or dementia. When in fact it's not this diagnosis, it's autism. When I talk about autism, I include ADHD, Attention Deficit Hyperactivity Disorder. I include it as one package. So we have people who don't have social skills. They have interests which are very, very focused. They have repetitive behavior. They repeat the same things. And some people have also sensitivities to sounds and lights. I have this slide here for women, adult women, but it's valid for any gender. So when an older people has the diagnosis of autism, they may feel relieved. They may say, I knew that all my life, and now I have been diagnosed and I know what's wrong with me. I don't think it's wrong as a condition because I don't see autism as a medical condition. So as I said, because it was poorly defined at the time when they were children, they have now the wrong diagnosis. And the common diagnosis for these people is anxiety, depression, and dementia. So what does it mean to be autistic and be an older person, adult? They may talk at inappropriate times or not talk at all in social situations. They avoid eye contact. So they try not to look at the other person in the eyes. They don't like being touched. They don't like being too close to other people. And they don't like new social situations. These are situations which are common in dementia as well. A demented person who has diagnosis of dementia may have these symptoms as well. So it's difficult to differentiate whether it's dementia or autism. And there is the risk of social isolation because people don't want to go out. So when we see a patient with social isolation, we may say that he has dementia, he has schizophrenia or something, when in fact it's not, it's autism. So in order to make the diagnosis, we have to take a history of the person and ask these different questions to try to find out the degree of autism. Many people don't want to change. We are all familiar with older people who are set in their ways. They don't want to change their routine. They take things very literally. They don't have an insight into feelings, so they don't care about the feelings of other people. And sometimes they appear rude or indifferent. So when they talk to somebody, they may appear rude without wanting to be rude. All of these that I mentioned are found also in dementia. Many of us have patients who have patients diagnosed with dementia, and they can exhibit these symptoms here. The problem with autism is that there is a lot of research about younger people and not enough research about older people. And another problem is that most of the research shows negative aspects of autism. It shows, as the name suggests, so ADHD is attention deficit, it's not a deficit. Hyperactivity disorder is not disorder. We see in the literature talking about conditions, medical conditions, there is no cure, there is no treatment. All of these are negative components of the disease, which make autism appear as something negative, some illness which we don't need to have. However, there are positive things of autism in older people. They have good memory, they can learn easily. Their concentration is good, but only if they are encouraged, focused. Some people are very good in academic matters which don't have social aspects, like science or mathematics. They can sit down in a laboratory and do experiments and be very brilliant at it. They are honest, reliable, dependable, and they can think out of the box. They have their own way of thinking, which is a way to create new ideas. And remember here at the bottom, I put it again, that autism is hidden genius. If you see a person with autism, you should consider him or her as a genius which cannot come out. This is a drawing by an autistic person. You may say, it's just a drawing of a hand. But if you see the details, it shows it's an example of the things that I mentioned before: attention to detail, determination, thinking out of the box. So this is just to show you that if we encourage a person, then all their hidden activities and capabilities can come out. So apart from dementia, other conditions that can be confused with autism is schizophrenia, obsessive compulsive disorders, depression, anxiety, I said already, and Diogenes syndrome. Diogenes syndrome is, I'll mention it here because it's interesting, is when people live on their own and they collect many, many things, rubbish, trash, items that have no value to anybody, but only to them. And they live in social withdrawal. They live without having any other interest apart from collecting things. This is a syndrome found in, let's say, traditional geriatric medicine, but it can be confused with autism and ADHD. But here are some differences that can help us in the diagnosis. For example, Diogenes syndrome is found mainly in older adults and who have some kind of mental disorder. Whereas ADHD and autism, many people, I would say more, have no mental disorders. So a way to differentiate it from dementia, because as I said, they have many common symptoms, common points of connection. They may have insomnia, both of them, both conditions may present with insomnia, communication, we said, cognitive impairment, and language and motor problems, we come across a person who cannot speak properly. Is it dementia or is it autism? These are the questions that we have to have in mind. These are some photographs of people who had autism. You can recognize them. Unfortunately, I couldn't find, or fortunately, I couldn't find any women who were famous and had autism. But maybe this is just a coincidence. So let's leave autism now in one part, and I'll tell you about a hypothesis which will explain a few other things that I'll say in a minute. We live in a technological society. Our society is full of digital information, which makes our brain work so that to assimilate that information. And we are slowly becoming one with technology. Humans and machines, you can all experience it, are living in a symbiotic relationship. That means that people who use their brain a lot, who are cognitively active, like people with autism who have a lot of brain power, then these people don't need to age. Nature will protect these people against aging. Because if you consider reproduction, we age. So because we die, we have to reproduce to replace the human gene pool. If we don't age, then we don't need to reproduce. This is a logical argument. It's a deeper argument, which we have to take into account. So if we reproduce, we also have aging. If we don't reproduce, because our brain is so, let's say, so cognitively advanced, then we don't need to have children to continue because we will live longer. And this brings us to another situation where people with autism are more likely to be LGBT compared to the general population. This may be a coincidence, or it may be based on what I said just now, because autism is genius. Therefore, if you are genius, you don't need to have children as well to be more genius than you, because you as an individual is enough for the cognitive society, for the advancement of cognitive society. So many people with autism don't have any interest in sex. Not only they don't have interest in traditional male-female relationship, they don't have any interest in sex at all. And this is explained by the fact that if you are more intelligent, more advanced in the cognitive skills, then sex becomes of secondary importance, because nature will keep us going ourselves and not our children. And we will see slowly that as society becomes more cognitive, childbearing decreases. You can see this in any advanced country. The more technological a country is, the less children they have per couple. You can check it in any statistics. So if we are in front of a person with autism, we have to show certain characteristics of understanding. Be more patient, understand that the other person is trying to say something, but give them time to respond. If they appear rude, just forgive them. They don't mean to be rude. They think that's how they speak, and you should forgive them and let it go and continue. And if they don't look at you in the eyes, doesn't matter. Let them talk, encourage them to talk and share their feelings without looking at you. And by the way, as I said, these are found in patients with dementia. So it's important to differentiate between the two. Now I will say about masking. Masking means to have the symptoms of autism, but deliberately cover them, mask them, don't show them. And this is something that many autistic persons do. They try to reduce their symptoms so that they could appear normal in a normal society. And this causes a lot of loss of energy, a lot of effort, anxiety. Um, so examples of masking is with the eye contact. It's easy to remember. They don't want to have eye contact. They don't look at you, but then they think something is wrong. No, I have to turn and look at this person. And they turn and look at you. They do it deliberately. It's not in their nature, but they do it deliberately. Or if they have some special interests, they hide them. They say, oh, no, I'm not interested in, I don't know, stamp collecting or something. And they have responses, ready-made responses. They say to they ask them, how are you? Oh, very well, thank you. It's a rehearsed response. They have a response for any standard social question they may come across. So as I said, they do this masking to fit in society and be accepted as individuals and not look different. But it's important to help them unmask because masking creates a lot of stress. So tell them, as the example I said with eye contact, it's okay. You don't need to look at me. You can, if you feel uncomfortable, look the other way and talk to me. And the person then it'll feel more calm. And if he doesn't want to look at you in the eyes, then they don't look at you in the eyes. So we come to the end of the presentation with some important messages that ADHD and autism, they are called neurodiverse conditions. They are not illnesses, but they are neurologically diverse than the normal, so-called average people. And as people grow old, we may find more and more people having this diagnosis. The problem is that because they don't have the correct diagnosis, they don't have the right treatment for it or the right interventions, I would say. We should be able to distinguish people who come with symptoms that can direct us towards autism. And if we don't have the expertise to deal with them, then refer them to a more specialist neurologist or psychiatrist or somebody who knows about autism in older people. And the final thing is that all positive aspects of an autistic person, we should find them and promote them. Autism is like having, you put the brake, you put your leg on the pedal, the gas of the car, and it goes, but at the same time, you have the brake on, have the brake and the accelerator. And if you have both conditions together, then it creates a lot of problems. And people say, look at him, this person is abnormal, has a disease. Let's put more brake on it, stop them, make them more normal. But the answer is not to put more brake, it's to leave the brake and let the acceleration zoom and take people to their capabilities, the full of their capabilities. So these are some of the symptoms that I have personally. With most of the symptoms that we discussed just now. But I try to mask many of them or not mask them, and I don't care if I appear normal or not normal. And just here a picture of my book, latest book, which I wrote with all my medical experiences as a 40-year career in medicine. Okay, and that's all. If you have any questions or something you didn't understand, we can discuss it. Thanks.
Thank you, Dr. Marius, for that impactful presentation. And I request the other participant, if you people have any question related to the presentation, please go ahead.
Hello, good afternoon for those who are in Japan. I'm Anna Sepulveda. I have a nephew who is autist. He's a kid, and thank you for this amazing presentation. And my question is, because I'm also linked to a platform to promote the employment of people over 60. I would like to hear from you, Professor. How can we integrate an autist person? How can we promote with these positive characteristics that you mentioned? How can we promote them to be active? For example, this platform is deeply linked to technology, so might be interesting.
Yes, we need to find their good aspects, their positive aspects. All autistic people may have something that they are very good at it. Maybe they are good at music or at mathematics or at drawing or at writing poetry. Everybody has something that is very positive, and then promote that something without our judging. I can't say to somebody, I know you like poetry, but poetry is not good. Don't promote it. Don't pursue it. That's wrong. Have to find certain characteristics and then promote those. But also it's important for the society to accept all of this, because society, many people come to me and said, oh, doctor, I have bad news. I have been diagnosed with autism. I said, it's not bad news. It's very good news. You have all these characteristics, find them and explore them and expand them. Stop following the traditional medical way that we have to have treatment, I have to give you tablets, go and see a specialist and so on. It's something that families, a supportive family can do. So,
Doctor, I actually thought that with the characteristics or the traits patients with ADHD, I think that yes, they probably, as older adults, probably will be more likely to be in isolation unless all these talk that we talk about how to get the elderly more active, preventive strategies to get them more healthy. If somehow we can get these individuals to be part of the solution, they probably will be one of the better or the pioneer in terms of be leader of the group, providing solutions and outside of the box. I worked with some of individual with autism, and I think that's absolutely right. They really do think outside of the box.
So they have to have people around them who also think outside the box, people who understand them. Maybe they have an idea which is very, very creative and they are embarrassed to say it. But if they mix with other people who have out of the box ideas, then they'll be more encouraged to share their ideas. And slowly they will gain confidence going out, meeting other people. But it is good to meet both with other autistic people and with neurotypical people, ordinary people, because then you can see the difference between the two. And if the person has the capability of comparing themselves to somebody who's typical in their abilities, they'll say, you see, they are low in cognitive abilities, let's say, and I am higher. So I have to continue what I'm doing. I'm doing something right. And it encourages them to be thinking positively.
Right. Thank you. It's a wonderful talk. Thank you.
Thank you.